Hi, I'm Dr. Bob DuVall. I'm the Residency and Fellowship Program Director at Sports Medicine of Atlanta. And I'm excited to be here at Oakworks today to tell you some features about the PT400M. Our particular focus is going to be on this Boiance crescent, the device here that we have for ideal optimal positioning for success of the cervical spine. But a unique new feature is going to be the Boiance float. That is this position under the crescent. This is positioned for patient comfort and subtle oscillation. Oscillation that will stimulate facet and intersegmental joint receptors to facilitate inhibition so the patient can maximize their neurophysiologic comfort and relaxation. All of this is predicated, of course, by the dual hinge quick lock face system, where we have two hinges to replicate the anatomy more appropriately of the human cervical spine. Whether the patient be supine or prone, we can maximize the positioning of subcranial positioning as well as mid-cervical and upper thoracic positioning, all while this contoured top enables us to comfortably position the upper extremities to remove dependent gravity traction from the thoracic, parascapular, and cervical musculature, particularly the middle trapezius and upper trapezius musculature. So we can optimize patient positioning, both supine and prone, with this apparatus. To further illustrate, I have Colleen here with me today. Colleen, do you mind coming in? Let you have a seat if you would, please. Sit right here so you can then lay down flat on your back. There you go. And position yourself here. Excellent. Now with this supine positioning, you can see the subtle oscillation that I can do to relax her. I passively don't have to put any effort into it, where traditionally I might go in and do subcranial myofascial release techniques to release her subcranial musculature. With this buoyancy and flotation component, I'm able to relax the patient in a very comfortable position. We often say you must try something to really experience it. That is true about this product. It exceeds what I can illustrate, and only if you try it will you really experience the full benefits of this product. Now, if I were to do subcranial or mid-cervical myofascial release, the comfort on my hands is unique here. I'm able to do posterior to anterior compression of her suboccipital musculature in a very contoured, comfortable manner, maintaining good alignment of her cervical spine. But this oscillation feature that I can now effortlessly do enables me to get the neurophysiologic effect of joint receptor firing that results in inhibition of hypertonic musculature, often found with forward head postures in particular. So I can now do my PA right like this, and she will relax and let me do that pressure. Then effortlessly, we can do prone work. Colleen, let me ask you to take your time gently and roll over to your stomach and position your face in the cradle. And the contoured top enables Colleen to comfortably rest her upper extremities on the shelf below. The contour allows uninhibited shoulder girdle protraction, which gives me convenient and complete access to the mid-cervical spine. I could induce a flexed position on this table that will enable me to even optimally position her further for more flexion, which is going to permit me to do, whether it be myofascial release or any other therapeutic interventions that don't want any hinging of hyperextension. Here too, I'm able to work and adjust my dual hinge on this quick lock face system. I'm going to tilt you forward a little bit, Colleen. A little more here. Now let me ask you to put your face right there. Now, excellent. And as you can see, I have removed any cervical hyperextension with this position. And again, now relax. I can do the oscillation while she's firmly supported just gentle rhythmic oscillations to cause further inhibition of her upper traps, all her splenius capitis, and her subcranial and mid-cervical musculature. These are unique features to the PT400M, compounded by this quick lock dual hinge system for cervical and upper thoracic positioning, and then the buoyant crescent that is magnified with the buoyant crescent float gives us the ability to do oscillation in a unique, unprecedented way. Again, I'm Dr. Bob DuVall, the Residency and Fellowship Program Director at Sports Medicine of Atlanta. Visit us at sportsmedicineofatlanta.com for additional continuing education and residency and fellowship opportunities.